Good morning. My name's Tina Forbeck, and I've been a trainer here for just over a year now. Came out of here from California almost 2 years ago, where I was a trainer for about 15 years. I did all kinds of things from yoga to small group training, one-on-one training, boot camps, little kids. I did homeschool kid camps and high school kids wanting to train for football, and mostly a small group and women, but everything. So I love what I do, and I'm happy to be here.
Hello, my name's Andy Camp, and I have been here training for a couple of months now. I'm transitioning from a career in physical therapy for about 30 years, getting to the preventative side of the street now, see if we can keep people healthy instead of respond and react to injuries. So I'm having a great time so far and look forward to your questions.
I'm Caitlin Blankenship. I got the fuzzy one. And I'm an athletic trainer. I do the injury assessments here for Tennessee Orthopedic Alliance. I've been an athletic trainer for going on 10 years. I've been here at the Village for 4. And I also love the preventative side of things, but also there for your whole journey from pre-injury to injury to post-injury to back on whatever activity you want to get to. So happy to be here.
My name is Zach Hillis. I'm a personal trainer. I've been here at the Wellness Center for 4 years. I've been personal training in total for almost 14 now. I got my bachelor's degree in exercise science from the University of North Alabama, where I also worked as a strength and conditioning coach for a year. So my specialty is in athletic strength and conditioning. Love to work with athletes of all ages, from 6 to now 86.
Nice. But 90's too old, huh?
That's past the cutoff, sorry.
Hi, I'm Janice Kearns. I have been teaching classes, cardio, fitness classes, dance classes since 1990. I became a trainer in 2014. It's been so long, I can't remember. I love giving people a program. I like to focus on functional fitness. I like to take people and start them on their journey to fitness with a lot of information about training and why, which I think helps motivate them. And thank you for having me.
Okay, so to get you guys started, I'm going to give some sample questions here, maybe to inspire some of you, and then I will turn it loose to our audience to ask anything they may want. And if you all run out of questions, don't worry, I have more.
Yay.
All right. And so if you would each take a moment to answer, and we'll get through this.
Oh, the fuzzy one.
So, philosophies and priorities. What is something commonly recommended in fitness that you personally do not prioritize as much as others might?
Initially, weight loss. I think everybody wants a certain target weight on the scale, and especially ladies. Initially, I'm always like this, Like, all right, so all that comes together with overall fitness and strength training, and the weight will get there. It's kind of it's part of the process, and it'll be achieved, but a lot of it's just the healthy habits, healthy strength training, and those gains will get there.
I'd say for me, it's more a philosophical thing. It's not so much what facet is, because I've in the short time I've been here, I've run into so many people who have so many different goals and ideas about what fitness is and how they want to proceed. I think the main thing that I have a discussion with, and the people come in with, I want to get this done as fast as possible, and that's just not the way it works. Fast gains or fast losses, it's just, and also injury risk. And so, the first discussion that I have when I talk to people is, my job is to get you started on something that you're going to do for the rest of your life, a little bit at a time, gradual gains, but steady gains to help you meet your goals, but meet them safely. And so that's the one thing that, I don't promise anybody quick results. I let them know that this is something that they're going to be working at for a long time, but if they do it right, do it safely, they'll avoid injury and get the results they need ultimately.
For me, I think something that I focus on that's a little bit different than traditional athletic training, because I'm usually seeing people once they are injured for some reason, and I like to take a whole body approach. So most people will come and say, oh, my shoulder hurts. well, I'm going to look at how does that shoulder move through a range of motion? Where is the disconnect? How does your rib cage move? How does your breathing get involved? How is your gait involved? Because everything is connected. And I think that's a big gap in healthcare today's is everybody's so specialized. So I kind of like to take that 10,000 foot view, make people better movers. And when you become a better mover, then you usually are in less pain overall.
That's wonderful. Yeah, I'd say, man, I'm trying to think of things that they haven't said that I could still touch on. Consistency is key. Small, steady changes. You heard that, basically from all three of them there, and man, you're nailing it. Don't fall into fads. Look at what's happening long term. Zoom out. Get the big picture. And see that small, consistent changes are going to get you somewhere you want to be and keep you there rather than giant cliffs and valleys that you could go through. Specifically, my training style, I'd say, is a bit different. I don't look at days by muscle group splits, which is something you see a lot, especially with men and in the commercial gym culture, arm day, leg day, shoulder day. I train the whole body every day, whether it's 3 sessions a week or 4 sessions a week. We're touching from head to toe. We're just training the body in different patterns of movement each day. So we're never repeating a movement or a movement style, but we are hitting the full body every time we touch the weights.
One of the things I talk to my clients about when they first come to me is how they can incorporate fitness in their everyday lives. It's nice for them to come here 2 to 3 times a week and work out with machines or work out with a trainer, but what you're going to do at home is going to be just as important as what you're doing in here, including nutrition, walking at home, making sure you get that 30 hours of that moderate intensity. I also give them class schedules. I try to get them involved in the classes. So I try to make it more than just about what they're doing in the gym. And I think it's important to do that.
Okay. So programming and training decisions. What is one exercise you frequently use that others overlook?
Are we going in order again,
Oh,
or
no,
just
we kinda cheated
anybody?
this time.
Okay,
You
all
guys
right,
get to go
okay,
first
okay. So one that we use that others might frequently overlook. I'd say personally weighted hip bridges. You do see, especially in post-surgery rehab settings, people doing a lot of body weight hip lifts off of the ground. But I think it's a move that everyone should do at every level of fitness, and you can modify and adapt both the positions and intensity to match where anyone is. I think the glutes, your butt cheeks, are the most neglected muscle on the body, and I think they're the most important muscle on the body for keeping you upright and healthy long term and keeping a nice, tall, healthy spine. So everybody overlooks the backside, and I would say specifically, hip lifts, glute bridges would be that one key move that I have everyone do that you don't always see.
I'll go. So one that I do, if anybody has spent any time around me, I incorporate breathing a lot into my exercises. And so I'll pair a certain breathing pattern with that. I also think the hamstrings and the glutes are often overlooked. So I like to do a 90-90 hip lift with respiratory cues in that so that your rib cage and your diaphragm get involved, because if you can't breathe, you can't live. And I think that is a very overlooked area of fitness. So rib cage positioning, mirroring the hip position, which is good diaphragmatic exercises. So you always get breathing with me.
Squats, 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 squats. Legs equal longevity, and grip strength also longevity. So I have people do hangs. I also have people do squats. We do squats in all my classes. A lot of my clients are using 25 pounds in their squats now because we've worked up to that. If they can't do a squat, when I meet them, I'll put a cushion on a chair and teach them how to push back just to tap it. And eventually we'll get to where they're doing a regular squat with a weight and they're really building up glutes and hamstrings.
Absolutely.
And they love them.
I love planks. My clients don't, but I really do. They just do so much. They achieve a lot, and those can be modified from everything from a wall push-up to a bar to on the floor, modified full planks. Excellent for your spinal stability, your core strength, shoulders, builds up our wrists, and I do a lot with them from all kinds of things, plank rows, plank reaches. Good old push-ups are also a wonderful thing to grow into that strength, which also is going to benefit your bench press and everything else with your chest strength. So for me, it's planks, and you'll see me my own workouts. I do a lot of planks and push-ups as well. They're excellent.
Loaded question, but one I'm glad you asked because I got a little bit to say about this. Okay, so
We're on a 30-second time.
and thank you for coming. But one of my big one, 30 years in rehab, everything is posture. Okay, if you're not aligned properly, if you don't have the appropriate length tension relationships in the muscles and the alignment of the joints, injury is going to happen. And one of those things that we will see oftentimes ignored in the gym, dorsal scapular strengthening. Okay, and I'm not talking loading up a row machine and hitting it, like you're going to Thermopylae, across the ocean. Okay, I'm talking about slow, low load, long duration holds. Okay, that train the muscle the way the muscle's designed to function. Remember, you got a couple different types of muscle group, volitional muscle group in the body. You've got the low load, long duration muscles. Your endurance muscles per se, and your burst muscles. Your ones that fire faster. Well, the ones that fire faster don't last as long. The ones that last longer don't move as much weight. And there's great research out there that indicates that if you train a muscle, if you train an endurance muscle like a burst muscle, it's going to start acting like a burst muscle and lose its functional capacity. And so you've got to establish that postural underpinning for all of the other things that you're doing. And unfortunately, here you try to get out of the way of the machines as fast as you can, but certain exercises just take a little longer. And that's one that you just have to invest the time in if you're going to do it appropriately. And I see it across the board. And not just the populations here. Transgenerationally. I mean, especially with phones being what they are these days, people are going to be here a lot more, and they're going to need that punch for dorsal scapular strengthening, postural correction that is just foundational to everything else that you do from the waist up and the waist down, frankly. So, yeah, that's a biggie that you'll see me doing all the time with a lot of my clients, and I think it bears good fruit.
Yes, banded face pulls, cable face pulls, scapular retractions, all of the above. Man, so important. What he said about phone posture. This generation that's right under us are all going to have terribly kyphotic spines by the time they're in their 50s and 60s, and it is scary to watch. Be conscious of where your shoulder blades are at all times.
Yep. They should be in your back pocket.
One. What is the biggest mistake you see active older adults make in terms of exercise?
I'll go first. Yeah. It kills me, and everybody sees it in here, I'm sure. People loading up way too much weight just to do it, and their form is horrific, and I'm just shocked more people don't hurt themselves doing that, so I'll stop there.
Yeah.
I went a little long with my last one. Ditto.
Can I ditto? Yeah, I see all the time compensation, and a lot of that has to do with overloading, not taking time to stack good posture. And so I see it all. The one that kills me, which is probably one you're talking about, is a bicep curl that becomes a low back exercise. I'm about to make everybody cringe. I see it all the time. Look at this. And you got to get the grunt with it. That is now a low back exercise. Your arm has not moved. And so trying to move too much weight too fast, slow, controlled motions.
Yeah, for sure. Form is always first, always, 110% of the time. I'd go on the opposite end, though. I'd say people I see a lot completely neglect training weak areas of their body, especially if they have a previous injury or surgical repair to that area. They'll say, I did my rehabilitation, this is what this limb can do now, and that's that. So therefore, I can't do X, Y, and Z for the rest of my life. That's not how it works at all. No limb is ever done. There is no function of your body you can't regain to a certain degree. So always work everything.
I forgot the question.
Ditto.
Because I'm watching going, what a great group of trainers, huh? Wow.
Here, I thought it was going to be
The
me.
biggest mistake you see active older adults make in their exercise routines?
Using tiny little namby-pamby weights.
Oh, the other way.
I try to tell people, well, if you follow online too, which there are a lot of orthopedic doctors I follow online, if you're not loading, if you're not stressing, also bone strength, different ways. I always tell people 20 jumps a day, men or women, because you need that bone strength. You want to keep yourself strong, and I think that weight loading is a big part of that. And again, doing things way too fast.
Right.
Yeah, and I also am aware of this. So overloading, right?
Yeah, absolutely.
Yeah, and I just want to kind of mention something again that Zach happened to bring up, which I could not agree with more. And coming from a rehabilitative background of 30 years, I'm not doing physical therapy now, but I mean previously when I did, you always hoped that when they left your clinic, they were going to find somebody like these people here to help them take it to the next level, because we get them back to function. That's all we can do, really, with regard to insurance limits and things like that. We can get you to where you can go to the store, take care of yourself, take care of your house, and things like that. But as far as taking it further, getting more, getting further down the road, improving yourself, even beyond where you were pre-surgically, those are all things that these people are expert in, and we just hope and pray that, and we recommend as much as we can, go over there, see a trainer, get going back into things. They'll take care of you, and if you give me the okay to talk to them, I can bring them up to speed on what we were dealing with you, and they can really dial you in really, really well. I don't know how often that happens, but I know in rehab we pray for that with our patients.
And we were able to do that.
Yeah, which was awesome.
Yeah.
Last one that I'll ask before turning it loose to you all. What is one mindset shift that dramatically improves your all's clients' progress?
Easy one. Yeah, stop focusing on aesthetics and start focusing on how you feel and move. For real, looking pretty is a side effect of all of this, and it's a lot of fun, but first focus on how your daily tasks feel, how your clothes fit, your confidence, how well you're sleeping, what you feel like when you wake up in the morning, like those small things that we all breeze past in our consciousness. Take good measure of what living feels like now, get on a solid plan, and 8 weeks later see what living feels like, and you'll be prettier too.
Can I get that in writing?
Yeah. Hey, here we go.
Can you ask the question?
How did you word the original question?
Yeah,
That's a great answer. What was the question again?
What is one mindset
Yes, thank you.
shift that dramatically improves your client's progress?
And this is something again. I'm harkening back to my rehab experience, and this was something that I began back there long ago and continue as I'm doing my personal training. That is, you may stop doing your exercise. I give you permission to discontinue your exercises 3 days after they nail the lid on your box. Okay? You may not stop before then. This has to be part of your lifestyle. This isn't something that you're doing for swimsuit season. This isn't something that you're doing, to get you ready for a pickleball tournament. This isn't something that you're doing because you're going to walk the Great Wall of China in 6 months, okay? This is something that has to become part of your life. It will improve your life. It will extend your life in mentation and emotion and physical capacity and interpersonal relationships. There's no downside. You do it safely, you do it correctly, you will be a better person and happier about it.
Yes. For me, for a lot, especially my female clients, is just the mindset of, yes, you can do that. You can do that. They're like, well, no, that's too heavy, or once I feel that, yes, they're safely can do that, they're amazed that I just did that. Well, of course you can. You're strong. People are stronger than they think they are. So I think once people get that through their head, especially generational, well, my mom never worked out. Well, no one, that's just a different thing for a lot of people, is knowing that they can do that. Our bodies are very strong. So.
How about instilling confidence? I do everything I can when I'm with them to build them up. The same thing that Tina said about helping them realize that they can. And once they've been training a few weeks, they start to notice the different functionality that they're starting to have because of the fact that they're starting to gain muscle. And that's really important, especially for people who come to me and say, well, when I was in college, I used to do, 150 pounds on the bench press. Well, dude, you're 75, right? So it's not going to happen, but you're going to get that functionality back. We just need to reel it back in and give you confidence about what you can do now, because it's always going to change.
I'll kind of ditto that. I think the mindset shift that has to happen, or that I like to do for my clients, is that belief that you can do things, but it may not happen as quickly as you want it to. And so when you realize that everything is connected, and yeah, you had a knee replacement, that doesn't mean that you can't kneel on the ground and play with your grandkids, or if you were to fall, can you get back up? And so one of my biggest things is, I think dittos what everybody has said, is just the limiting beliefs, eliminating those limiting beliefs that you have about yourself, because your mind is really the only limiting factor to what you can do. There may be some physical things at some point, but you can work through those things to get those things. Like my favorite thing was having a 93-year-old patient that could get up and down off the ground, and that was something that she was told she could never do because of age. And well, if you fall, how are you going to get up? Well, I don't know, and so being able, it didn't happen overnight, but you're 93 and can get up and down off the ground. How many 93-year-olds do you know that could get on the ground right now and stand up? How many of you, we can, it's, I'm like, man, I'm like 30 and I got to get, So you've got to practice it. And I think that's the thing. It's those daily little practices that get you to where you want to go.
Okay, I'll open up the floor to you all real quick before I get back on my train. If you all have questions for the table here.
I just had a comment. When I came here, I hadn't exercised for a while. Janice knows. I started classes several years ago, probably 5 now. And it was amazing just in the first 2 years. It took me a long time to get comfortable. Mm-hmm. But now I'm there 5 days a week. I do different classes. I had a knee replacement, but that was the best thing I did in the whole world, because now I can jump and I can do side steps and I can do things I didn't realize I couldn't do. I thought I was too old to do. And that's not right. So thank you, everybody. It's been good.
I have a question for you all. In terms of, I recognize that everything in the body is connected and it all works together, but people may have specific sports that they want to excel in. So how do you help people who want to be a better swimmer, a better pickleball player, a better golfer? How do you approach that, a more focused regimen?
I'd say the best way to approach that is looking for sport-specific actions that you can add to well-known compound and isolation lifts. So let's talk about swimming specifically, because it's a super, super shoulder-dominant action. Of course, you use your legs too, but in every stroke, you're using shoulders, lats, and chest for the most part there. So looking at motions that would incorporate the major muscles, that push and pull in the upper body, tapping into isolation motions like how Andy was talking about, the endurance-based motions that are slow twitch, we say, type 1. And so getting repetition to the supporting muscles around your 3 to 4 big lifts, and then adding in balance and agility and coordination motions that you would use in the sport. So every sport is rotational, so a good place to start would be banded or cable rotations to take care of that. You're going to have a certain amount of joint stiffness with every stroke to get as much power as possible. So working positional holds, just like a march hold or like a wall squat hold, things that are going to make the tendons themselves stronger. And then on top of that, I think swimming itself takes care of a lot of the cardiovascular need for swimming. That makes sense enough, but also making sure that you're tapping into the higher end of the heart rate range at least once a week, whether that be on a stationary cardio machine or walking up the hill or doing a step class, something that's going to push you in an interval fashion closer to your max heart rate. So that, I guess, answer would be take a full body approach like we're talking about, but look for actions that occur in the pool and get as close as you can to replicating those under resistance. So a lot of sports will be rotational: golf, pickleball, swimming, tennis. So use those rotational patterns is kind of what I'm saying there.
Take the next one if you like. Could not agree with Zach more. I mean, he gave a much more full-throated explanation of how these things are approached than I probably would have been able to do. Coming from the rehab side of the street, one of the things that I will look at, apart from specialization, which is, if you've got somebody, he talks about, rotation. So if we're looking at golf, we're looking at a very specific type of rotation. If we're looking at tennis, we're looking at very specific types of movement patterning. So specialization is one of the things that you want to look at. And within specialization, one of the things that I would definitely focus on are what are the injuries I've seen with this activity over time? Because you see them at all levels. I mean, you see professional golf, watching the Olympics. These people are rubbing themselves down and taping themselves up. I mean, these are young athletes that are absolutely fantastic and in great shape. They're still injuring themselves when they perform at particular levels. So one of the things that I'll do is look at things like, you're playing tennis, we're going to work on the elbow, the lateral elbow, because we're going to prevent tennis elbow as much as we can. I'm going to show you some stretches for that. I'm going to show you some things that are, as we build these muscles, as we do an effective job of making you better at what you do and increasing the load across those structures, we're going to make sure that you're adapting those structures to prevent and avoid injury that can come from increasing the load across these structures, which they may not have, become accustomed to in a like manner for the intensities of the actual competitions which you're going to be engaging in. Of course, we're going to train you safe, but then you get out there on the court, you hit it a little harder. You're a little bit more aggressive. And so you've got more capacity in the tissues. They can affect greater stresses across these zones. And I just want to make sure that you're safe and avoiding injury while you're doing these things that you want to do.
Absolutely. Yeah, basically what Andy said and everyone said is just to be sure. A lot of folks tend to jump out and get right into their activity, whatever sport that may be, and to teach them appropriate warm-ups and stretching for whatever you're doing, whether it's your workout, your sport, your pickleball, warm up your ankles, warm up whatever you need to do, and then good stretching afterwards. It's boring. Nobody likes to do that, myself included, but it's super important to stretch appropriately, and it doesn't just stay that way. We stretch, and then the next day it needs to be done again. So it's just something that we need to do.
So sport specific, this is like my sweet spot, being background in athletic training. I love sport specific training. So when you're talking about swimming, I'm going to ditto what Zach said about you need to find ways to mimic those actions on land. If for swimming specifically, also realizing that your joints can only move through the range that you have the capacity to move them. And so if you are unable to put that into simple terms, if you are unable to lift your shoulder above this without compensating, again, we talked about bicep compensation, right, where we're extending here, but it's the same with range of motion. If you can't lift your shoulder past here without compensating, you're going to get injured. You're going to have that wearing down. So I love mobility training as a big part of that. So people are very familiar with flexibility. People are very familiar with strength training, but that mobility training of how well does your joint move through a range of motion is, I think, the biggest gap in the fitness world. And so, you've got to be able to train to have a full range of motion in that shoulder, in those shoulder blades, in your hips, whatever for what you're looking for. And that is low load, slow movement under control. And you can do that for every joint in the body out there. And Kelly Sturrock got really famous for it with his FRC training and that sort of stuff, with doing rotational CARS movements, which just is circumferential articular rotations, basically moving your joint through range of motion. And so that would be my suggestion, is train for the movements that you want and make sure that your joints have the capacity to move through the range you're putting the demand on. If you're trying to serve tennis and you can't get that arm up, if you're trying to swim, can't get that arm up, because that's where we see it most, then you need to train your mobility first before strength and flexibility, and they all work together to make sure that you can be the best at that activity.
Anything else to add on that one?
Balance. You're going to use it in everything that you do, and I don't teach a single class that doesn't involve balance in it. And people here do everything. Pickleball, tennis, everything. That's all I can think of. But balance is everything. Because if you can't stand up, you're not going to play anything. And we don't want to overlook that.
Anything else from you all? Okay, then I get to interrogate some.
Oh boy, can't wait.
What is one popular exercise you often modify or avoid, and why? Now, you could go fad with this, but I'd prefer you choose something more traditional if you don't mind.
Okay, yeah, I don't program burpees. I don't think many people in the world should be doing burpees. I know that's controversial to a lot of people because a lot of people love them and think they're the coolest, most intense thing you can do.
Nobody loves burpees.
You'd be surprised. I agree with you. I definitely don't like them. But in general, I guess you could put a lot of jumping / plyometric / agility moves into that same big box with burpees. It is good to build up a plyometric base, but most people do not have the tendon capacity to do high-level plyometrics. Therefore, if you take somebody from 0 and put them on 100, they're gonna get hurt. So, yeah, if you want to train explosively, slowly build up the ability to train explosively. Start with, a 1 or 2 inch pogo hop or box jump. And then maybe in a year and a half, you can be to where you do a set of 3 to 5 burpees at a time, which are the most you should ever do at a time. And take it slow. Like we've said, slow, consistent gains. Keep yourself safe. Keep yourself athletic. Avoid burpees.
Box jumps.
Tina's like, I like it. You're lying. Nobody likes burpees.
Box jumps. I've had people come to me from different gyms, places that they've trained. Well, my trainer always had me jumping. I've seen Patrick Mahomes do it, and he does it really well because he practices it all the time. But why do you need to jump up on a 3-foot box? I don't know. It puts a lot of impact on your knees, and I just think that hopping in place, landing toe ball heel, wearing a weighted vest, I think there are a lot of other things that our demographics can do without jumping up on a big high box. There was a guy in the gym last summer. I could tell that he didn't know what he was doing, and that was when we had that metal box in here, which we no longer have. Hit both shins, pulled the skin off all the way up. And I remember thinking the only thing is that he must have seen somebody do it and decided that that was going to be the thing to do, and it was horrible. I don't have anybody jump on boxes.
No, I'll piggyback on that. Box jumps are something I never programmed. They're great. I come from a CrossFit background. We did a lot of box jumps, and if you're going to do them, step down. People get in a hurry and want to get all those reps in real quick, and it just drives me crazy. If you're going to jump up, step down. And yeah, I've just seen some horrible things happen. So there are a lot of other things to do besides that. Yeah.
ahead, take it. You got anything?
I'm gonna throw some controversy into the discussion.
Ready? Here we go.
All right. So I'm gonna kick the beehive. All right. Guy comes to me, and not just one, over the years, multiple times. I can run on a treadmill 7 miles an hour for 45 minutes, but I go around my block twice and I'm exhausted. Okay? I'm all about cardiovascular training. I love cardiovascular training. I love functional cardiovascular training. I like treadmills for training people how to walk following surgery. I like treadmills for getting a heart rate up to do a cardiac stress test. I hate treadmills for regular cardiovascular training. And the reason for that, you'll never see me get a patient on or a client, on a treadmill unless I got them going backwards, uphill. Okay? And the reason for that is, okay, and I just got to do it. Okay. So you see these big muscles in the back of your body? Okay? They're big for a reason. They have a huge job. And their job is when you step forward, the foot gets stuck to the ground. That leg tries to come back. That leg can't come back. But it's pulling with these guys to try and get it back. When it can't go back, body goes forward. Okay? These are the guys that drive you forward. You can do this all day long. You're not going to go anywhere if this guy on the other side doesn't pull back. This guy just kind of catches you in the front. Now, I like non-powered treadmills, the ones that you drive with your own motion. Those are great because you're actually functionally working the muscles that you have to work. But when you're on a treadmill, basically all you're doing is throwing your legs forward, and the primary drive force that you need to utilize, the hamstrings and the glutes, the job's done for them. The treadmill then moves the leg to the back. Okay? So when you have to finally engage these muscles out in the world, okay, the cardiovascular load that you then put on yourself is greater than what you're finding on the treadmill because you're not using these muscles the way that they're supposed to be utilized. Okay? So I have a real issue with treadmill use for cardiovascular training. I just don't think it's the best way to do it. And so, there are a lot of great machines out there, ellipticals. They make you work through the full range. They make you pull your leg back. There's all kinds of things that you can do. And bikes, it's not a walking motion, but it's a good cardiovascular motion. It mimics the activity that you're going to be doing when you're riding a bike, and it kind of gets the leg involved. But yeah, I've just never been a fan of treadmills, and so that's something that you'll never see me program with my clients. If we want to do cardiovascular training, we'll find a better way.
Anything you want to add?
They summed it up. What was the question?
Exercises we don't program.
What is one popular exercise you often modify or avoid?
I don't do a lot of leg extension exercises. I think that puts a lot of torque on the front of the knee, and I see people all the time say, oh, I'm going to extend. Again, I don't think it's functional. I love a leg curl to the best of them. I love squats. I love lunges. I love unilateral motions. But leg extensions, that's just asking for a bad day.
Okay. I'm gonna, if you have something to add to this, go ahead. I'm gonna say if you don't have anything to add, feel free to just pass the mic on this one because I'm gonna try to get you through a couple of these more rapid fire. How do you decide when someone is ready to progress versus when they should hold steady?
General principle, okay, and that is 8 to 12 repetitions. If we're doing resistor training, when they get to the maximum normative amount in a particular area, it's time